What is high blood pressure? What is elevated blood pressure? What is hypertension? What does it mean when your doctor tells you that you have these conditions, elevated blood pressure, or even that you have hypertension? Think of your heart as a strong water pump or bicycle pump, pushing blood through a network of pipes called arteries that actually do have a little bit of stretch as the heart pumps to deliver oxygen and energy to your whole body. The force of that blood pushing against the walls of those tubes, these arteries, is called your blood pressure. Why is this important? High blood pressure is common. 1 in 3 adults live with hypertension, and it is considered a silent killer as it significantly contributes to many deaths from heart attacks and strokes. Let me explain. When we measure blood pressure, we write down 2 numbers. The top number is the pumping pressure, called systolic, which measures the force when your heart squeezes and forces the blood to rush around your body at high speed. The bottom number is the resting pressure, called diastolic, which is the pressure when your heart relaxes between the beats. This pressure does not go down to 0, but it's maintained usually above 60 millimeters of mercury. Millimeters of mercury, mmHg, is the standard unit of measurement for blood pressure. For humans around the world, normal blood pressure is less than 120/60. It should usually be between 90/60 millimeters mercury and 120/80 millimeters mercury. However, if these numbers go higher than 120/80, the more and more greater pressure is being pressed against these delicate pipes. If these pressures stay higher than normal for a long time, it can damage these pipes, leading them to become more stiff and narrow. It is this damage that is the reason high blood pressure causes cardiovascular disease, damaging blood vessels in our heart, our legs, our kidneys, our brain, all over our body. Rarely, if the blood pressure suddenly becomes very high, it can cause symptoms such as headaches, blurred vision, or even chest pain. This is why your doctor wants to first understand what blood pressure you have normally, and if it is raised, your doctor would want to support you to get it lower. Latest evidence shows that the higher your blood pressure is away from that normal, the more damage it is thought to do. Elevated blood pressure is the terms that doctors use in Europe to describe the top number, the systolic blood pressure of 121/139 millimeters of mercury, or where the bottom number, the diastolic blood pressure, is between 70 to 89 millimeters of mercury. Hypertension is where these numbers are higher still. And you're usually considered to have hypertension if your reading is 140/90 or higher when checked by your healthcare professional, or 135/85 when you check your blood pressure yourself at home. That's because you're usually relaxed more at home. The blood pressure is a little lower.